So I'm professor at the Karolinska Institute. Klas WIMAN is my name. And so I work on cancer research and especially the p53, which is a very important gene in cancer. And my lab is trying to develop new cancer therapy by making p53 work again when it's mutated. It's important because cancer is a disease, a major health problem, as we all know, and there's no effective treatment for many cancer patients. And that was an EU-funded project, so we applied a number of years ago. You know, EU has these calls for research integrated project with many labs in Europe, also some companies. So we just worked together. We got funded by the EU. We're trying to develop new cancer therapy. So we have a compound we discovered 20 years ago now, in fact. Now it's been tested in the clinic since 2009, and now it's approaching a so-called phase 3. For clinical development of a new drug, you have to go from phase 1, phase 2, phase 3. So we're actually now in phase 3 with this compound. In the best case, what we hope is that it can become an approved. The thing also with p53 mutation, it's something that, you know, as I mentioned, 50% of all human tumors have p53 mutation. So potentially many patients can be treated if there is an efficient drug for reactivation of mutant p53. And improve the health, improve diagnosis. I think, and as a scientist, you also want to understand. I think it has a high status. I think there's a general understanding or feeling that this is important. I think so. One thing with Sweden, we have the Nobel Prizes. So, and then every year in early October, the Nobel Prizes for the different Nobel Prizes are announced. And then in December, all the Nobel laureates come to Stockholm and get the prize ceremony, which puts a, science, for a change, science gets the attention in media. And there's a lot of discussion about the real, not only the ceremonies and things, but the real science. I think that's good.